Did you know there are several types of breast cancer and they are not all treated the same? Welcome to the Inspired Vitality Show. I'm Catherine, and in this video, I'm going to explain how triple-negative breast cancer differs and where you can find support if you have been diagnosed with it. Triple-negative breast cancer day is observed every March 3rd to call attention to this less common but more aggressive type of breast cancer. It accounts for 15 to 20% of all breast cancer diagnoses. Several studies suggest that being premenopausal or of African ancestry increases your risk of developing triple-negative breast cancer. Among African American women who develop breast cancer, there is an estimated 20 to 40% chance of the breast cancer being triple-negative. Some breast cancers are sensitive to the body's naturally occurring female hormones, estrogen and progesterone. The breast cancer cells have receptors on the outside of their walls that can catch specific hormones that circulate through your body. To determine a type of breast cancer, a doctor looks for the presence or absence of receptors or proteins that live inside or on the surface of a cell and bind to something in the body to cause the cell to react. You may have heard of the estrogen receptor, known as ER, progesterone receptor, known as PR, and the human epidermal growth factor receptor 2, known as HER2. Knowing your breast cancer is sensitive to hormones gives you and your doctor a better idea of how best to treat the cancer or prevent the cancer from recurring. Hormone status of breast cancers can include the following. There's the ER positive. The cells of this type of breast cancer have receptors that allow them to use the hormone estrogen to grow. Treatment with anti-estrogen hormone or endocrine therapy can block the growth of the cancer cells. Then there's the PR positive. This type of breast cancer is sensitive to progesterone and the cells of the receptors that allow them to use this hormone to grow. Treatment with endocrine therapy blocks the growth of the cancer cells. It is common to have cancer that is both ER positive and PR positive. Next is the HR negative. This type of cancer doesn't have hormone receptors, so it won't be affected by the endocrine treatments aimed at blocking hormones in the body. Then there's the HER2 gene. Cancer cells that have too many copies of the HER2 gene, known as HER2 positive cancers, produce too much of the growth-promoting protein called HER2. Targeted therapy drugs are available to shut down the HER2 protein, thus slowing the growth and killing these cancer cells. Then there's the triple-negative breast cancer. That includes tumors that are ER negative, PR negative, and HER2 negative, thus the triple-negative breast cancer. Treatment will be based on tumor size, tumor grade, and whether the cancer has traveled to your lymph nodes or other parts of your body. Standard treatment options for triple-negative breast cancer include chemotherapy, surgery, and radiation. However, some say chemo has been shown to be the most effective treatment for triple-negative breast cancer. The TNBC Foundation is the founder of Triple-Negative Breast Cancer Day and is a credible source for triple-negative breast cancer information. It's a catalyst for science and patient advocacy groups, and also a caring community for cancer patients. They can be found at tnbcfoundation.org as well as on social media. If you or your loved one has been diagnosed with triple-negative breast cancer, be sure to check them out. I remember when I was diagnosed with breast cancer, and I didn't even know there were different types of breast cancer. I received a blur of information when I was told of my diagnosis, and I believe that had I been more informed, I could have absorbed the information so much better. I would have had more knowledge about breast cancer ahead of time to help me go forward. Providing you with education and resources that you can keep in your back pocket is why I'm doing these videos. So please give me a like or a comment if you have found this helpful. See you in the next video.